I don't think she's used to having people like me that actually want to fix it, you know?
Welcome back to Anxiety Makes Me Poop. So we go from laughing
Yes.
from the Clopen effect to maybe
My
we'll get a
nose
little
is like
serious right now.
I probably should have blown my nose. I was laughing so hard.
Oh gosh, what was I looking at? Okay, we're gonna go here.
Oh, that's funny.
So you mentioned when we worked together today.
Yes.
And you were mentioning something that I was not aware of.
Yes.
So I want to learn all about what you learned.
I said, when we get together tonight, I want to talk about medical anxiety.
Yeah.
Right? Because we all heard my story that I got diagnosed with diabetes back in February. And, I felt like I was doing really good with everything. And then all of a sudden I'm just like, oh my God, am I making all the wrong decisions? It's like, it's so much to take in. And, they offer you a nutritionalist, but I kind of I wanted to do kind of keto to lower my blood sugar, as minimal meds as I could and more food, diet, exercise, stuff like that, right? None of us want to just live on meds, right? Mm-hmm. And then, I have people around me that are type 2 and they have their way of doing it. And everybody has been so supportive. And I said this before, I cannot appreciate enough everybody that's been supporting me, right? Because I don't think I'd even make it this far. I probably would have done something crazy. But it just dawned on me one day. I'm looking up protein in your urine.
Okay.
Right? Mm-hmm. Because I knew that's why I'm on Jardiance.
Okay.
Which is a pill. And it helps you I know it's gross, but pee out sugar. Okay. Right? But it also helps with your kidney health. Okay. Because if you have protein in your pee, it means that your kidneys aren't filtering correctly.
Okay.
And please
protein's passing through the filter.
Right.
Which
and
really they should be filtering it all.
Correct.
Okay.
Maybe a little bit's okay. I don't even know. I don't come at me if I say anything wrong, okay? Because I'm learning.
I mean, this is your life.
So when I had my second blood draw from when I found out I was diabetic, right? My A1C was at a 13. My blood sugar was 400. When I went back 3.5 months later, I took my A1C down to a 6.6.
Good for you.
And my fasting blood sugar was still in the hundreds, which pissed me off.
Oh man.
But I told you today, I made you and our coworker, everybody tested their blood sugar today, right? And you were at a 92. And you said you hadn't eaten. You did have coffee, but no sugar in your coffee.
Correct.
Right? Some people have a higher blood sugar in the morning. I know after I have my coffee, I take a shower, I move around, and I get to work. I can test my blood sugar. I'm at an 87.
Oh, wow.
You know what I mean? So it's but fasting, haven't eaten in over 12 hours, haven't drank any coffee or anything. I go in, it's at a 120. I'm like, what the hell?
Oh, yeah.
So anyways, I told you it's not a bad thing, right? It very well could be. And a lot of factors. Did you sleep well last night? What did you do in the morning? Were you active? Did you sit on your phone? That's all factors, right? Are you sick? Do you have a temperature? Are you on any medicine? All a factor in your blood sugar. So, but going back to my kidney health. So I'm like, what do I need to do? Because I understand long-term diabetes that isn't taken care of. What happens? Your kidneys shut down.
Can we go back for a second? How did you
Absolutely.
know?
So when I went for my second, I just went to the hospital. They took my blood. And then a couple days later, the nurse calls me and says, oh, the doctor went over your blood. You got great numbers, this and that. But she still wants you to go on that cholesterol medicine. And I was like, why?
Okay.
Because I am literally dropped my cholesterol 20 or 30 points from where it was.
Amazing.
In 2 months. And I'm 10 points literally away from it being good.
Yeah.
Why does she want me to go on that?
Right.
And the doctor's like, well, if you don't want to take it, that's your, we're not here to pressure you, blah, blah, blah. Well, then I'm looking because I'm thinking about this, right? And I'm like, okay, I got protein in my pee. I'm Googling things, and like they just like, okay, well, if you have, severe kidney shutdown, and I'm like, well, I'm not there yet. What can I do to improve my kidney health, So I start Googling the medicine that I'm taking, right? So the Jardiance is one to improve your kidney health.
Okay.
Well, guess what else is? Cholesterol medicine. Because something that happens in your kidneys is when you have high blood sugar constantly, high cholesterol, high blood pressure, I'm a smoker, it constricts your blood vessels. Yeah. And then that makes it hard. Like, that's why they're so worried about your feet. Because if you get constricted blood vessels a lot, your feet kind of die off, right? Mm-hmm. So that's what they want to monitor. So she is concerned about my protein in my urine. So then I went back to my numbers when I was in the hospital, and she had me pee in a cup when I went to go get my blood drawn again. And I thought, oh, yep, because of that protein. I bet that's so much better because I've improved my diet. I've done this. Well, it went up. It was even more protein in my urine than what I had when I went to the hospital.
Oh.
Which,
do you remember the numbers?
I don't.
Okay.
I mean,
the range or anything?
I could pull it up.
Oh, that's okay. No, I was just curious.
They're high. They're abnormally high. I would say if 100 is the normal, I'm at 250. You know what I mean?
Okay.
So
okay.
it's high.
It's high up there.
Yeah.
Okay. Okay.
So I associated that to I'm eating way more protein, right? Because I'm trying to cut down on my carbs,
right?
Not eat sugar. So I'm kind of going the keto route. I'm eating eggs, meat, few vegetables, few fruits, almost carnivore I was trying to do, which is very hard, by the way.
Yeah.
It's hard.
Yeah.
It's like not a lot of choice, Mm-hmm. But so now I'm thinking like, oh my God, I'm eating all this protein and I'm just putting my kidneys into more stress because they have to process all this protein and they can't process the protein, right? That's my train of thought, right?
Yep. That would be mine too.
So I'm Googling like, what is a kidney healthy diet?
Oh, okay. Okay.
So you want to cut protein.
Jeez.
You want to cut potassium, which my potassium was high when I was in the hospital. I would eat bananas all the time. Those are not good for diabetics, right? So I cut out bananas and I'm like, okay, but you have to watch for potassium in a lot of dark colored foods. Also, phosphates are in dark colored foods. What's dark colored foods to you?
Like I'm always thinking like spinach because I eat veggies, that kind of thing.
Spinach, broccoli.
Yeah. The greens.
Right?
Yeah.
Plus rye bread. What was I eating instead of regular
bread?
That's all you eat,
right? Yeah. Oh my goodness. It's almost like you try to improve one thing and something else.
And they're saying you should eat lighter colored foods. White bread, white rice.
Which is not
oatmeal. And I'm like, I can't.
I just spent 3 months stepping away from all that. Yeah.
So it's like, oh my God. I was like...
Well, that's overwhelming.
I was having anxiety about it for real. Like, am I killing myself? Am I helping myself? Am I doing anything right in my life?
You're focused on one thing. And I'm looking at your arm because of your monitor, right?
Yeah.
And you're focusing on one thing, and then all of a sudden you find out that something else is.
It's probably killing me.
Goodness.
So, my endo was your endo.
Yep.
You had her for thyroid.
Yep.
I have her for diabetes. And we've had totally different experiences with her, right?
We have.
Like, it's not that I don't like her. This is how I look at it. When I worked at the grocery store and I worked at the service desk, I tried to tell myself a lot. Not everybody knows the process, Cass.
Right.
You need to explain it to them.
Yeah.
You get so into your everyday routine that you just know the process and you think, well, why don't they know that? Well, they don't do it every day. I feel like that doctor is so stuck in the process that she doesn't realize. She is very used to people saying, oh, yeah, okay, I'll get some more exercise. They just take the meds and go about their day, and they don't make lifestyle changes. Mm-hmm. I don't think she's used to having people like me that actually want to fix it, did she already see me as a too far gone case and said, well, she's not going to take the meds anyway, so I'm not even going to try.
She put you in the bucket of everybody else instead of remembering there's a person behind all this that she might be able to help.
Right.
Okay.
You know,
I can see that.
Plus, I'm talking to my regular doctor who obviously she knows about diabetes, but that's not her specialty.
Right.
So she's saying, you do what you're comfortable with. Look at your numbers are looking great. You know, you're doing the right thing. All your numbers are coming down. Your triglycerides are down, you know, this and that. Then I'm talking to my mom, you know, because she's dealt with this for a couple of years. And she's like carnivore, right? What do you need vegetables for, you know? Because I told her, you know, if I make a plate of meat, vegetables, and some carbs, I eat my vegetables, which is my fiber. Then I eat my carbs. Or my meat.
Yep.
And then I'll eat my carbs, you know. If I'm still hungry.
Yep.
And she's like, I told her, you know, that's what I do, this and that. And then she's like, well, you know, do you really feel? And I'm like, well, that's my thought process. If I'm pissing out protein because my body can't function correctly, I can't just continue to eat protein, right?
Right.
So I don't know what to do. I've been Googling stuff and it's like so annoying. And then I'm like, do I like try to get a different doctor?
Do you call the office back and see what she thinks? Why don't you send something in the portal?
Yeah.
I'm very concerned about my high protein. Is that the reason that she wants me on cholesterol?
Yeah.
Just tell them you're very concerned.
Right.
Can she call me or have a nurse call you after they talk to her?
Yeah. Yeah. So
So I have to say, I want to add on to your story.
Okay.
Just super quick about her personality.
Yeah.
And what you said about how she probably just gives people medicine and off they go and they're just
right. Kind of a lost cause.
Right. Which is very sad.
Please
take care of yourself.
Yeah.
People.
Yeah.
When I first went to her, I was very sick, had Graves' disease, whatever. She fixed it. And now the past few years when I go to see her, every time she goes to leave, she looks at me and she says, you know, you're one of my easiest patients.
Yeah.
I do everything right. Like when I know that something's wrong, I fix it like you did.
Yeah.
So how often does she see the same people
right.
that just don't want to...
They haven't made the changes.
Right, they haven't made the changes.
You know, and that's so difficult.
Now, does she say that to a lot of people? I don't know, but...
Yeah.
I don't think so.
Have something, I feel like you needed medical intervention, where obviously in the beginning I needed medical intervention.
Right, and now it's way of life.
But it's like, okay, well, can we just like focus on that? Like, fuck my blood sugar right now. That I have under control. You know, but then it's just like, oh, well, I'll see you in 6 months. And I'm like, you're not worried about this? Should I even be worried about this? Is this normal? Is this what everybody goes through when they get diabetes? Clearly not, because I have other friends that have diabetes. They don't have protein in their pee, you know, so it's not the same for everybody. So it's like, oh my God, I'm just like freaking out. So.
Okay, so maybe it's time for a kidney specialist.
Yeah.
In that same network that can go and maybe explain to you so that you're not freaking out.
Yeah.
Maybe there is just one meat to avoid or maybe one protein to avoid or something like that.
Yeah.
You know, if you don't get the right answer, maybe it's, you know, time to see somebody else and say, well, this is what I have. What do you think?
Right.
You know, and just, you could do you don't have to stay with that person. Just do an initial consultation and just be like, here, what do you think? You know,
I feel like I'm ready for a different doctor.
Yeah, you're right. Someone that explains more.
I mean, maybe I will reach out and be like, hey, you know, this is worrying
if you're
me,
not,
and
if you're
see
not
how they respond.
with it,
yeah.
Well, I mean, perfect example, not to bring it back on me, but I had the one doctor tell me, oh, it's just old age, nothing's wrong. And it took me 3 years to find another doctor.
Yeah.
Don't do that.
Right.
You've been doing very good. If you are uncomfortable, find someone right away. Do not wait the 3 years like I did.
Yeah, because obviously what I'm doing isn't working.
Oof. Well, it is working, though.
I mean,
you are so much better than you were 3 or 4 months ago.
For parts of it is.
Right,
you know.
right. But now
then
it's the
I'm
next
like,
one.
oh, God, you know, am I going to have to, like, go on dialysis and get a new kidney?
I'll give you a new kidney. Don't worry
about
it.
Stop. Don't even
Don't
say
worry
that. If I had to pick anybody to get a kidney from, it'd probably be you.
Don't even worry about that.
Oh, so, yeah, that's my anxiety lately. It's just, it's so much.
It is.
And you try to, you know, I want to listen to the doctors and stuff, and I take my prescriptions and that, you know. I mean, I quit doing the insulin because I was going dangerously low.
Right.
You know, it wasn't dangerous, don't get me wrong, but it was a lot for me, you know. I didn't need insulin when I was not eating that many carbs and I was taking metformin and the Jardiance and all that.
Yeah.
I didn't need the insulin. Then my middle of the night, my sugar's dropping into the 50s, like I don't need to be that low. So, I quit doing that. And then it's like, do I need metformin anymore? Like if I'm controlling this by myself, but then it's like metformin can cause kidney issues. So should I be taking that? I don't know. It's just so much information at one time that you have to learn
only
about.
Been a few months for you.
And if you give a shit and you actually want to make changes, it's like really hard, you know?
Absolutely.
I feel like some people are like, oh, okay, I'm diabetic now, like I'll just like walk more and not eat any sugar. It's not that easy for me.
Yeah.
It's just not that easy for me.
Yeah.
I don't know.
We all have our vices, right?
Yeah,
for sure.
Yeah.
I have a question. So if you didn't know that your number was high and you saw it, would you have any other symptoms that you are aware of? Did you Google symptoms?
You don't really have symptoms
when that's happening
in early kidney failure.
Okay. And is that what it is really? Is that what it is?
Yeah.
Okay.
Yeah, basically.
Okay.
Yeah.
Yeah. So it's time to maybe see another doctor.
Yeah. It's basically not something that you want to mess around with.
Right. That sounds like it.
Yeah.
Okay. So here's another question for me then. Or for you, rather, not for me. I'm talk to myself.
From me to you.
From me to you. How many patients out there, the doctor just looks at the numbers and they have this going on and they go, okay, I'll take that medicine. And they just trust the doctor.
Yeah.
Until it's too late?
Yeah.
Then what?
Yeah.
So again, you have to be your own advocate.
Right.
Which it sounds like you are there.
I'm trying.
You're there. And I almost feel like this is not for me. Like I need to get more information. I need to find someone that doesn't just look at me and my numbers.
As a number.
I want to be the patient.
Yeah.
Right?
And that's so hard now. And
it is because they're so busy.
Like no hate to doctors. I mean, when it takes you 6 months to even get an appointment, these doctors are stressed, And I was, of course, watching TikTok the other day, my favorite. And this guy's like, when did we stop, like, getting touched by doctors?
Yeah.
I remember being a kid, they'd be touching my throat, my back. They'd be pushing on my tummy. Like, doctors are like, oh, well, how do you feel? What are you here for? Oh, you're sick. Here's a prescription. Okay, bye. On to the next one,
really?
That's kind of how I feel like, And then as I'm sitting in the waiting room and it's saying, we don't just give out, what do you call it? What do you take when you're sick? Antibiotics. We don't give antibiotics out for just anything because then it makes, your immune resistant.
System. Yeah, sure.
Germs and this and that. But I'll tell you what, every time I go there, they give me a damn antibiotic.
Darn it.
Every time.
You gotta stop being
not
sick.
COVID, not COVID, but anytime I've had a sinus infection, anything like that, or if I, whatever, an upper respiratory, I go home with antibiotics,
Well, maybe you have the true.
They'll
what
tell
the
you
antibiotics would.
Well, it's a virus. It's got to run its course. But then I've been told I have viruses, and they send me home with antibiotics. I don't know what to believe anymore. I'm not a doctor. I have no clue.
So here's another question for you. Are people addicted to antibiotics?
I don't think so.
Oh, okay. They don't melt them down or
no.
Okay.
I don't think there's anything you could do like nefarious with an antibiotic,
right.
other than like you put it in too much in a person's food, probably give them diarrhea.
Right.
Maybe something. I mean, or you'll give them maybe a yeast infection.
Oh, darn it! There's a few people on the list I would be happily doing.
I think those are like the two worst things you could do with an antibiotic.
Gosh. All right, so it's nothing like painkillers or something like that.
No, they're not like opiates or anything.
So as the friend that I am, I had to chat GPT and Google common causes of protein in urine. I was interested in this only because Stephen, my son, when he was very young, they did not catch strep. Again, he went to an office that did not continue on with the long strep test and missed it. And it ended up in his kidneys.
Right.
And so he blew up, got swollen, and, we had to go to the hospital. They had to transport him to a children's hospital and he went right to a kidney specialist who always wore a yellow shirt. Yeah. Which is very cute.
Yeah.
So I was interested in that because sometimes when he gets his tests, I believe they say there's a little bit still because they're damaged from when he was younger.
Right.
Okay. But I guess they've been pretty good the past couple years.
Your kidneys are not like your liver. It cannot rebuild itself.
I think lungs and liver are very
Right.
forgiving. I've heard.
Yes.
The doctors can let us know, but kidneys are not, right?
Yeah.
Because they're that filtration system.
Yeah.
So, of course, temporary or less concerning causes of protein in your urine is intense exercise, dehydration, all makes sense. Fever,
Yeah.
illness, emotional stress, exposure to extreme cold. I did not know that one.
Oh, I
Or
didn't know that
pregnancy.
one. Yeah.
So I guess that's why you always pee in a cup, right? When you're pregnant.
Yeah.
Every single time you go to every time you go to a doctor's appointment
checkup,
when you're
yeah.
pregnant, it's the first thing you do.
Yeah.
Okay. In these cases, the protein will disappear, even, but it says in medical causes, high blood pressure,
Yep.
diabetes,
Yep.
kidney infections, kidney disease, autoimmune, such as lupus, heart disease, certain medications.
Yep.
So, and then of course it talks about how the kidneys filter waste and all that kind of stuff. So then it kind of gives you some ideas, which you're already doing. You're staying hydrated.
Yeah.
You're managing your blood pressure pretty good.
My blood pressure is good.
It always has been, right?
She wanted to put me on blood pressure medicine when I left the hospital. And I was like, I have not really had a past of high blood pressure. I think I was stressed in the hospital.
Oh, absolutely.
And it was elevated the whole time I was in the hospital. It never went down. I just went for a checkup the other day. It was 127/85, I think, or whatever it's supposed to be.
And that's a norm for you.
It was, what's the lower number supposed to be?
Well, like 120/80.
Okay, yeah.
Yeah,
So it was
You're fine.
127/80.
Yeah. Mm-hmm.
5, maybe.
Yeah.
So yeah, I was like, nah.
No cause for
But
concern.
do I need to monitor that more because of this issue?
I would think your blood pressure elevates when something's wrong because mine does, but I
Yeah.
don't know if that's the same with everyone.
Oh, yeah.
Every single time I've had something go wrong,
Yeah.
the first thing that told me so was my blood
Your
pressure.
blood pressure.
Yep.
Yeah.
So for 3 years, my blood pressure was up, and everyone's like, your blood pressure's up, your cholesterol's up. Why?
Yeah.
As soon as I had my
'Cause they're
surgery,
stressing.
3 months later when I got my blood work done, and
They were
everything
like,
was
"Oh,
fine,
look."
and my blood pressure was down.
Oh, look, we took care of the issue.
Yep.
And now you're healthy again.
Yep. Goodness.
Weird.
The next one is control blood sugar. You got that. Eat a balanced diet. Done.
Yeah.
Maintain a healthy weight. Done. You've lost some weight, right?
Just a little bit.
Yeah, a lot.
Not a lot.
Avoid smoking and limit alcohol. So,
So
we all can work
those are
on
my
that,
issues
right?
for sure.
And
Yeah.
review your medications. So,
Yeah.
I mean, you're
Yeah. Yeah,
90%
see, because
on the list.
pain relievers, NSAIDs, so ibuprofen,
Mm-hmm.
stuff like that. Everything goes through. Everyone talks about how your liver filters, your kidneys filter a lot.
Mm-hmm.
And I know a few people in my life that, either they had UTIs often as children or got a bad UTI when they were a teenager and it ended up in their kidneys. Now they don't get UTIs anymore. It goes straight to a kidney infection.
Oh, boy.
So it's
that's
like,
got to be so painful.
I don't want to deal with that.
No way. Have you ever had kidney or
I
any
just
kind of
had my first UTI
ever?
Earlier this year.
That's right. And that was before you got sick,
That
right?
was before I
Do you
found
think
out I
your-
had diabetes.
Do you think your body was telling
Probably.
you a little bit of an alarm?
Probably.
Who knows,
Because
right?
I walked into the hospital and I was like, I'm sorry, I'm pissing blood.
Gosh,
Like
that
it's-
is scary.
It's 6 a.m. Okay. Like I didn't want to take off of work. I figured it was a UTI. And I was like, let me just go. I know people are going to say, you went to the ER for a UTI. That's what the doctor
That was
did.
they were open.
It was an emergency.
yeah.
I needed to get the shit taken care of. And they were like, and I said, I feel like an asshole. I'm at the, and she goes, we know what you have. We can cure what you have.
Yeah.
Here's some pills by. Like they had me pee in a cup, said, yep, you got a UTI. They didn't test my blood, nothing, right? Because I wasn't dizzy. I wasn't having heart palpitation. They just said, yep, you got a UTI. Here you go. You can pick up your prescription. Go to work. I was like, okay, bye.
Gosh. So that was your first one ever.
That was my first one. And I told her that. I said, I'm 40-something years old. This is the first. And she goes, nah, you've had them before. You just didn't know. It didn't present like this.
Oh, okay.
She goes, everybody gets them.
Oh, interesting.
It's just how your body fights them off.
Wow.
Can it, are you wiping front to back?
Yeah.
All that, So I was always, this is gross. This is probably TMI. I was never a sweep my poop into my vagina area, but I feel like I would wipe. Now I'm a tapper.
Oh, okay.
I feel like tapping is definitely the way to go.
You're a tapper.
I'm a tapper.
Okay. I will
And-
never be able to look at you the same.
No,
But that's okay. That's totally fine.
Just so you know, when I'm in there, I'm just tapping
tapping
away. And then my one friend, she's had them often. She's had a couple kids and stuff, you know. And so she's like, I'm telling you, I come home from work, I immediately change my clothes, change my underwear, you know, only cotton underwear, this and that. Don't wear underwear at night if you don't have to, you know, like let that shit breathe out. So it's like, you know, I have all these supportive friends.
Yeah.
It's so great growing old with people that like you're comfortable around, you know?
Get it. And they've probably had something else.
We can talk about poop. We can talk about pee. We can talk about periods. We can talk about childbirth.
Yeah,
like,
some in the
all this
medical
stuff.
field, nothing surprises them, right?
you know? So, yeah.
Well, will you come back on and share with us what you decided?
Yeah,
New
I
doctor
will.
or what's going on?
If anybody listens to this one and they want me to come back, I'll come back.
There's a lot of people that listen.
Okay.
So they will want to hear the follow-up. I am certain of it.
Yeah. All right.
Well, thanks.
Thanks for listening.
sharing.
Yeah. It felt good to like get it off my chest. I just been stewing on it.
Yep. Good.
So, yeah. And thanks for the advice. I appreciate it.
Yeah.
Yeah.
All right.
All right.
We'll
love
talk
you.
to you next time.
All right.
Love
bye.
you. Bye.